We all know the grief the opioid crisis produces. Broken families, stolen opportunity, lost loved ones. This epidemic has been especially severe in my home state of Kentucky, claiming lives at a record pace. In light of this urgent problem, I'm proud Congress is fighting back. We've passed substantial bipartisan legislation to give communities the resources they need. The most recent government funding bill provided billions of dollars of additional support, but the work to end the suffering continues. One of the most heartbreaking facts is the skyrocketing number of infants who are born dependent on opioids. Defenseless children start their lives suffering from addiction. That's why in 2015, I sponsored, along with Senator Casey, the bipartisan Protecting Our Infants Act. As the first law to specifically address prenatal opioid exposure, it directed the Secretary of Health and Human Services to review the subject of opioid abuse in prenatal and infant patients. Our bill tasked the Secretary with developing strategies to fill the gaps in opioid research and programming and provide recommendations for preventing further harm to expecting mothers and newborns. Now it's time to build on our success and better protect vulnerable children. So today I'll introduce the Protecting Moms and Infants Act. This legislation directs the Secretary of HHS to report on the implementation of the strategies developed in the previous bill. It would have the Centers for Disease Control and Prevention develop educational materials to better inform doctors and expecting mothers about opioid alternatives. And it authorizes increased funding for a competitive federal grant to help organizations address this particular part of the opioid crisis. This bill continues our years-long efforts to protect the most vulnerable. I want to thank Senator Casey and my colleague from Kentucky, Congressman Brett Guthrie, who is sponsoring companion legislation over in the House. Medical professionals, law enforcement officials, and many others across Kentucky are working every day to bring an end to the misery of the opioid epidemic. This legislation will continue that fight, and I would urge my colleagues to support it.